In 2017, the World Health Organization (WHO) reported that the number of Nigerian women suffering from cervical cancer annually totaled over 14,000, making it the second leading cause of cancer deaths among Nigerian women. Cervical cancer is a type of cancer that affects the lowest part of the uterus, the womb. A woman is at risk once she clocks 15, and thousands of Nigerian women are at risk. This is quite unfortunate, knowing that this type of cancer can be avoided before it becomes full-blown. These women from efferentCARES, a non-governmental organization, are doing something about this. They are providing a cervical cancer screening program tagged Screen Her. So starting in the month of April 2019, the free screening program will be taking place at 7 designated health centers. They are St. Leo Catholic Medical Center, Ikeja, Regina Mundi Catholic Hospital, Mushin, Rivet Specialist Hospital, Ejigbo, St. Timothy Catholic Hospital, Ojedubega, St. Raphael Divine Mercy Specialist Hospital, Ikorodu, Amuwo Dofi Maternal and Child Center, and Lagos Island Maternity Hospital. Ezinaya, who is the founder of efferentCARES Initiative, she says the program has provided access to cervical cancer education, screening and treatment to over 3,000 women and trained 150 healthcare providers on quality cervical cancer screening practices.
So we're inviting women in around Mushin and Ikeja to come out for this 2-day cervical cancer screening. In Mushin, we're going to be having it from the 24th to the 25th, and around Ikeja is going to be from the 26th and the 27th. It is very, very important that women come out because cervical cancer is a very silent but very deadly. And it's very important that you know your status.
I tell you, a lot of people feel, well, these people, they are saying that it's going to be free. That when we get there, they will start telling us that one payment is coming or the other. But I tell you, by the time they get in here and they find out that it's completely free, and aside that there are even other things that they have to gain.
Sexually active women who started at a young age have a high risk of getting this cancer. Women who have been diagnosed with a cervical cancer usually have about 5 years to live.
Cervical cancer, the rates of cervical cancer, I think we've greatly underrated it. But partnering with efferentCARES, we are going somewhere because the enlightenment is higher these days. At least in a week, I want to speak about Regina Mundi first, Regina Mundi Catholic Hospital, Mushin. In a week, we have about 8 to 10 women coming in to ask, when can I get screened?
And the fact that cervical cancer is not something that cannot be treated or prevented. It's something that can actually be prevented and treated. So we are saying early detection actually will save a lot of lives. The numbers of deaths that we continue to record every year as a result of cervical cancer is because of late detection, because people don't even know.
Awareness of cervical cancer remains low in many Nigerian communities. Experts from efferentCARES Initiative want more women to go for the screening exercise for early detection. Remember that over 14,000 women are diagnosed with cervical cancer in Nigeria every year, and over 8,000 of them die of the disease. Women should know that prevention is better than cure.